Welcome back to Wellness Ways, your trusted source for health and wellness tips. Today we've got something important for you, especially if you're dealing with knee pain or just want to keep your knees strong and healthy. Vitamins. We're going to talk about the key vitamins that can make a big difference in your joint health. But before we get started, if you're committed to improving your health, don't forget to subscribe to our channel. Now let's dive in. Whether you're an athlete dealing with knee issues like arthrosis, or simply aiming to keep your knees in top shape as you age, this video is for you. Before we explore the vitamins, let's quickly go over what's happening inside your knees. Your knee is a complex structure made up of bones, cartilage, ligaments, and the synovial membrane. Cartilage is a tough, flexible tissue that allows smooth movement between bones. It acts as a cushion, absorbing shocks and enabling pain-free motion. However, over time, this crucial tissue can wear down, get damaged, or even crack. This leads to inflammation, resulting in pain, swelling, and stiffness. This condition is often referred to as knee arthrosis, a common problem many people face. The good news: there are natural ways to support your knee health. Vitamins play an essential role in maintaining healthy knees, especially the cartilage. Cartilage doesn't regenerate easily, so once it's damaged, it can be difficult to repair. That's why prevention and proper care are so important. Let's break down the top vitamins that can help your knees and how they work. First on the list is vitamin C. We all know vitamin C as an immune system booster, but did you know it's also vital for knee health? Vitamin C is essential for producing collagen, the primary component of all connective tissues, including cartilage. Collagen plays a role in wound healing and the repair and maintenance of bones, teeth, and cartilage. If your knee cartilage is causing problems, you might be low on vitamin C. It's also an antioxidant that neutralizes free radicals, reducing inflammation and preventing further damage. You can find vitamin C in foods like kiwi, bell peppers, oranges, strawberries, papaya, pineapple, grapefruit, broccoli, mango, tomatoes, and spinach. Aim for at least 500 milligrams of vitamin C daily, either from your diet or supplements. Next up is vitamin D. This vitamin is unique because your body can produce it when exposed to sunlight. Vitamin D is crucial for the development and maintenance of healthy bones. It aids in the proper absorption of calcium, which is necessary for strong bones and teeth. Vitamin D also helps prevent and treat cartilage deterioration. Studies show that adequate levels of vitamin D can slow the progression of osteoarthritis. The recommended daily intake of vitamin D is around 1,000 IU, but you may need more if you have a deficiency. Lastly, let's talk about vitamin K. This fat-soluble vitamin is essential for healthy blood clotting, bone health, and heart health. Vitamin K comes in two main forms: vitamin K1, found in leafy greens and some vegetable oils, and vitamin K2, found in dairy products, fermented foods, and animal products. Vitamin K2 is particularly important for bone health as it activates a protein that helps bind calcium to your bones. Higher intakes of K2 have been shown to improve bone density and reduce the risk of fractures. Always take vitamin K with healthy fats like olive or coconut oil to improve absorption. Now that we've covered these key vitamins, let's talk about how you can incorporate them into your daily routine to support your knee health. First, aim for a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats. This will ensure you're getting a variety of nutrients, including the vitamins we've discussed. If you find it hard to get enough vitamins through your diet, consider taking supplements. A good multivitamin can help fill in the gaps. Look specifically for supplements that include glucosamine, chondroitin, vitamin C, vitamin D, and vitamin K. Adding bone broth to your diet is another great way to support joint health, as it's rich in glucosamine and other beneficial nutrients. Also, spend some time in the sun each day to boost your vitamin D levels. About 15-20 minutes of sun exposure should do the trick. If you live in an area with limited sunlight, especially during winter, consider a vitamin D supplement to ensure you're getting enough. Include plenty of leafy greens and fermented foods in your meals to boost your vitamin K intake. Spinach, kale, and broccoli are great options, as are fermented foods like yogurt, kefir, and sauerkraut. Don't forget regular exercise to keep your joints healthy and strong. Low-impact activities like swimming, cycling, and walking are great for maintaining knee health without putting too much strain on your joints. Strength training can also help by building the muscles around your knees, providing better support and stability. And of course, maintaining a healthy weight is crucial for knee health. Excess weight puts extra stress on your knees, accelerating cartilage wear and tear. Aim for a balanced diet and regular exercise to keep your weight in check. Lastly, staying hydrated is key. Drink plenty of water throughout the day to keep your joints lubricated and support overall joint health. By understanding the importance of vitamins like vitamin C, vitamin D, and vitamin K, and incorporating them into your daily routine, you can significantly improve your knee health. Remember, prevention is key, and taking these steps can help you maintain strong, healthy knees for years to come. If you found this video helpful, please give it a thumbs up and consider subscribing to our channel for more health and wellness tips. Don't forget to hit the bell icon so you're notified whenever we post new content. And if you have any questions or topics you'd like us to cover, drop them in the comments below. Thanks for watching and take care of those knees.